Many patients come to Auradale with the same wish. I want the results, but I don't want scars. I can understand that feeling. I also know from my experience that this expectation, while it's natural, is not realistic. I'm Dr. Gauravh Jannawar. Today, I will explain in plain language how scar forms, what precautions we take to minimize the scar, and what you can do after the surgery so that you get the best results of your scars. This is what I do day after day in my surgical practice. Simple scar biology. First, let's talk about the scar biology. When the skin or the dermis is cut, body lays down collagen to repair the gap, and the repaired tissues, they look different from the normal skin. The main drivers of how the scar will actually look are genetics and skin type. Other factors like location of the scar, tension across the wound, infection, smoking, or uncontrolled diabetes. Factors like this can also play a role in how your scar look. Your genes are the biggest single predictor of how ultimately your scar will look. Why no scar promises are misleading. I will be direct. No surgeon can promise a no scar therapy. If someone is promising that, treat that as a red flag. What I promise my patient is this: I will place the incisions thoughtfully. I will use techniques which will reduce the tensions on the surgical side, and I'll guide you through the aftercare. And this is how we aim for fine, thin, pale line and not the claims of invisible scars. Incision positioning, my practice. In my practice, I plan my incisions keeping camouflage in my mind. I always plan my incisions along the natural skin creases or into the skin folds or in hairlines if appropriate. For example, breast scars are hidden under the inframammary fold, so they are covered with the clothing. Tummy tuck scars are kept low so that they are covered in the belt area. Even about the eyelid surgeries, we plan our incisions into the eyelid skin creases so that they are out of the sight. Techniques and tension control. What I do in operation theatre. Technique matters as much as placement. In surgery, I handle tissues gently, align edges appropriately, and use layered skin closures. Internally, I use absorbable sutures to support the skin edges so that we minimize the tension across the suture line, and we use very thin sutures on the skin and support them with steri-strips. The key goal is to remove the stress from the skin margins because tension widens the scar over time, and that's why tension is the enemy of fine scar. Aftercare, what I instruct every Auradale patient to do. As a surgeon, we set the stage, but you play a starring role in aftercare. My routine instructions are simple and evidence-based. First, keep the wound clean, then follow the dressing instructions exactly as they are told. Do not pick the scabs. Avoid nicotine in any form because nicotine can hamper the blood flow. Protect the scar from direct sun exposure for at least 12 months because UV exposure can darken the scar area. After about 2 to 3 weeks, I recommend my patient to start with a gentle massage so that their tissues become soft. I also recommend my patients using silicone sheets or gels because evidence has shown that they help in thinning of the scar. Aftercare is where patient makes big differences. Realistic timeline. Be patient. Scars evolve. In first 2 to 3 weeks, you will find the scar is darker and firmer. In next 3 to 6 months, the scar becomes soft and paler. Maybe in 6 to 12 months, the scar become less noticeable and start fading. Improvements can continue up to 18 months, and the early appearances are not to be confused with the final results. Most scars look better down 6 to 12 months than at 6 weeks. Treatment I use for problematic scars. If scar becomes thick or raised, we still have reliable options. In my clinic, I use intralesional steroids to reduce the redness and thickness of early scars. For texture and collagen remodeling, I offer fractional CO2 laser or microneedling sessions. These, when combined with PRP or platelet-rich plasma, can offer better results. For scars which are wide and poorly positioned, surgical scar revision and placing the scar line along the skin creases can give much better results and a finer scar. So each treatment is tailored to the scar and the patient. I want to share a small example from Auradale. A young female who came with a facial scar underneath her eye was concerned about the scar. We did a scar revision, managed a scar line which was hidden in her skin creases, and we did a meticulous layered closure, minimizing the tension across the suture line. We started her on silicone treatment at around 3 weeks after the procedure. Over 9 months, scar faded and was reduced to a flattened thin line, and she told us that it has now stopped bothering her for her public appearances. Stories like this emphasize the planning in scar care is very important. Scar can carry emotional weight. If the scar is disturbing your confidence, that feeling is real and valid. I always discuss physical plan and emotional path with my patients. If you are worried, say so in your consult. We work together to set realistic expectations, and when needed, we plan staged approaches to improve both form and feeling. Quick FAQs. Quick answers to some common questions. Can scar be erased? No. Can they be greatly improved? Yes. When should I start my scar treatment? After the wound closure and surgeon's go ahead, typically about 2 to 3 weeks after your scar procedure. Does insurance cover scar revision? Only if there is a functional restriction. Sometimes scar revisions are covered under insurances. If you are considering surgery, ask your surgeon exactly where are they going to plan the incisions, how are they going to close, and how are they going to manage it afterwards. These questions will tell you a lot about their care. If you would like a calm, realistic consult, we would be happy to welcome you at Auradale Clinic. I'm Dr. Gauravh Jannawar, and I'm here to keep it real.